So I do simulated patients, so they're all plastic or faking it where I work, which is great, but Amy is going to pretend to be a simulated patient for me today. The hard part for Amy is she's incredibly health savvy, as you saw. So she's going to try to be more of a simulated patient than her real patient. And the idea of a simulated patient is they're used to train health professionals how to interview, how to do physical exams, how to counsel, all of those things. So the idea is simulated patients really only answer the question that they're being asked. They don't sort of unload like sometimes the real patient does, because we're actually trying to teach health professionals what are the right questions to ask. So that's always a challenge for our Amy, because she's really smart, as you probably have noticed. Many scleroderma patients are very health savvy, but many of us are maybe not as compliant as we should be, or don't look forward to the future as much as some of the others. So that's what we're going to do. When I do an exercise like this, everybody has an opportunity to call a timeout. Or, as I said to my interviewers who were so wonderfully volunteered to help me out, is you can always stop and phone a friend, right? So if you're not sure where you'd go next, that's when you get to stop and phone a friend. And I will try to provide some feedback at the same time. Someone's nodding like, don't phone a friend out here. Don't call to me. But we may be asking for audience participation and just maybe some thoughts from the audience. So don't be shy. Raise your hand and then belt it out, because we won't have a microphone for you. All right, so I'm going to let each member of the team introduce themselves and just quickly sum up their role, because I think we did a good job of that at the table, and I want to be mindful of the time. And someone's going to have to help me when I've gone like 5 or 8 minutes to remind me to switch. So I don't know, somebody wave me down. All right, go.
Hi, my name is Abigail Mills. I'm a second-year occupational therapy student, and OT really encompasses the whole life. So we look at activities of daily living, how people are doing getting dressed, getting on and off the toilet, showering, as well as cooking and doing the things that they want to do.
Hello. Actually, you know what? You can just go right in and interview Amy right now, and then as each of you go, you can introduce your role. You can introduce your role right to them. So you can assume you did that. That's great. Keep going. She heard you. She's got it.
All right. So I'm here today because you've been referred to occupational therapy. Have you ever seen an occupational therapist before?
Yes.
Okay. So you know a little bit about what we do. Is that correct?
Yes.
Okay. So I'm going to start. Can you just tell me about your everyday, like what you have going on, things that you struggle with, things that you do well? I just like to hear about, what your typical day looks like.
Okay. My typical day is, I'll give you more of what I struggle with, because everybody has mostly the same things in a typical day. Getting up and getting dressed, I have trouble with buttons, snaps, shoelaces, putting my socks on, and then doing like up and down the stairs, or making my bed, kind of simple things like that, opening jars, eating with regular silverware, things like that.
So it sounds like because of your disease, you have trouble, getting dressed in the morning. It takes you a little longer, and, kind of decreased strength, getting jars open and things like that. So OT can definitely help with that. We can provide adaptive equipment and educate you on how to use that equipment. We can help increase your strength and kind of work on maintaining your range of motion, since I know scleroderma definitely affects your range of motion, and, just in general, helping you feel more successful in the things that you're doing.
Okay.
So I'm going to call a pause because it looked like a natural time. So what I usually do when I have a lot smaller group is I'll say, tell me what you saw. But if I start doing that, there's way too many of you. So I'm going to tell you what I saw. First of all, she unpacked a lot of information by giving a pretty open-ended question. Tell me about your typical day. Tell me about your struggles. And Amy chose to concentrate on her struggles, which makes very good sense to me. But that was a lot of struggles. So I'm interested to know what led you to your very empathic and empowering remark after.
Motivational interviewing?
Yeah, we love motivational interviewing. But yeah, you don't want to go, okay, sometimes, so summarizing can be a really good thing in an interview, but sometimes summarizing can be overwhelming. So I actually thought you handled that really well. You sort of did a broad general statement and you said, we can help you. We can give you, this is what we do. So I thought that was really great. So you talked about being able to adapt some things, offering her that and giving her some skills and really gave her some hope, which I thought was great. Did you notice how Amy just started by saying, yes, no? I was proud of her. But then she did unload a lot of struggles. So I thought that was great. Do you want to pick one thing that you think you want to concentrate on now that might lead you to your next volunteer?
I would definitely like to examine your diet and your meal prep and things like that. So I'm going to pass the mic over to nutrition.
Hello, my name's Victoria.
Here, why don't you guys switch spots just because it'll be easier and otherwise you're going to feel like you're leaning in to talk. No one likes it when you can't make eye contact and you're creepily leaning around a corner to talk to them.
All right, hello, my name's Victoria.
You can do that right to her. You can introduce yourself right to her. It's like they don't even
Victoria.
exist.
What's your name?
Amy.
Would you like to be referred to as Amy, correct?
Yep.
All right, so I'm a dietetic intern. Here I'm trying to focus on malabsorption because that can be an issue, any nutritional inadequacies you may have, ways to improve your digestive symptoms. Are you experiencing any GI issues?
Yes.
What kind of GI issues are you experiencing?
I have reflux, trouble swallowing, slow digestion, just to name a few.
How are you managing these symptoms?
Usually with diet, medication.
What does your diet look like?
I try to stay away from fried things. I try to keep a low sodium diet. I cut my food up really small. I try to have a beverage with each meal so it's easier to swallow.
Yeah, those are all great things. How about the frequency of your meals? Are you eating 3 times a day? Or are you eating more often, smaller meals?
I'm a grazer. I can't really eat a whole meal in one sitting, so I usually have smaller meals throughout the day, maybe 4 meals.
Yes, it actually shown that if you eat less but more often, it will actually help improve malabsorption. So that's wonderful. How about your
I'm
weight?
going to pause. You practically have to swallow that mic for them to hear you. Not swallow it, but it's got to be really close to your mouth so we can hear you.
Sorry. All right. So how about your weight? Have you noticed any weight changes over time?
When I was first diagnosed, I noticed I lost a lot of weight. Now I'm pretty much maintaining maybe a pound or 2, but I like to keep an eye on it because of the sodium.
Mm-hmm. So what's a lot of weight? What was that number?
It was like 30 pounds.
30 pounds? How long?
6 months.
6 months, yeah. So that's a lot of weight loss. So why low sodium? Why did you decide to go that way?
I have pulmonary hypertension, so I like to keep the sodium down per my pulmonologist for fluid retention.
Mm-hmm. Are there any other foods that you're sensitive to that you've noticed?
Dairy, I try to stay away from that. It irritates my throat, and I was getting thrush a lot, so I try to stay away from dairy and anything acidic because of the reflux.
Yes, to help with your GERD. That's a great way to do that. So you said you're drinking more often.
Mm-hmm.
Why did you decide to drink more often? To help with dry mouth? To help with other symptoms?
It helps with my dry mouth, and it also helps swallowing things because I have an issue with swallowing breads and anything that's drier or chewier, like bigger, chewier. Yeah.
Yeah, that's awesome that you're doing that. Are you taking any supplements, any probiotics?
I take a probiotic once a day, and then I do, because I have malabsorption problem with the scleroderma, sometimes I have to do iron infusions. I do vitamin B injections once a month, and I take a high dose of vitamin D once a week.
All right, we're going to pause. All right, I saw a lot of great stuff. Again, one of the things I actually want to back up that actually both interviewers did is they found out where she was at. Have you seen an OT before? They really made sure that they found that out, and I think with nutrition as well. So it's always important to find out where is your patient at? What do they know? I always say to medical students, you have to meet your patient. I have to meet my students on their arc. You have to meet your patients on their arc as well. If she's newly diagnosed, she may not know any of this, but she's had a diagnosis for a while, so you want to find that out. That helps you, as we were talking about before, to make sure that you use the right language. The expert panel was talking about that. What's jargon to some people is not jargon to other people, and you really have to listen to how they respond in order to know. So I thought you guys did a great job of that. I liked that you made no assumptions about GI issues. You didn't just assume. You didn't say, well, people with scleroderma have GI issues. Maybe they don't. Maybe that's not her biggest issue. Maybe swallowing is her biggest issue. So I thought that was really, really great. And you managed not to ask leading questions, which is leading questions are, you don't eat 3 meals a day, 3 big meals a day. You ask, tell me about your pattern of eating, right? So I thought that was really great. And you asked a lot of great follow-up questions, right? We have this idea that even though you had your notes, you sort of went with her, right? You still asked the next question. You don't want to store what your next question is. You want to listen, and then you want to ask that. And how did you show, didn't you really feel like she was listening? Didn't you feel like both of them were really listening? They were making really good eye contact. They were nodding. They were responding empathically. They were doing all of those things. And that really makes a difference to patients. It's important. I also really like that you asked her perspective about why she has a low sodium diet instead of just saying, oh, that's good. That gets you a lot of information. That's what I talked about earlier. Eliciting your patient's perspective can be huge, absolutely huge. So make sure you do that. And then you did a little bit of a summary, which was appropriate there. I thought it was good. You always want to make sure that your patients are on the same page as you, which is why summarizing is so important. I also like after a summary to say, is there anything else you want to tell me? Because patients come to the doctor with a story, but they sometimes forget that they haven't given you a piece of that story. And as you're summarizing, they remember. So I think that's great. All right, thank you. I appreciate it. Let's see. I have to see who's next. That's next.
Hello. Can you hear me? Okay. Hi. Hi, my name is Antoinette. I'm a pharmacy student, but I guess in this case I'm the pharmacist. So currently my role would be to help you manage medications, help you understand side effects and adverse effects that might occur with the medications, as well as track if you are actually adhering to the medication regimen that we're talking about. All right. So first off, are you taking any medications to manage your scleroderma symptoms?
Yes.
Oh, excellent. So based on the recommendation I heard from your dietitian, I understand that you have GERD. Is that correct?
That's correct.
And are you taking a medication to treat that?
Yes, I take several.
All right. And are you experiencing any adverse effects of these medications?
In general, sometimes there can be constipation, but other than that, nothing really. I've been on them for a long time, so.
Excellent. And so do you take other, I'm asking a lot of yes or no questions. I hope that's okay.
You can ask the obvious questions. That's your job.
Okay. What other medications are you on currently for treatment of symptoms?
For which symptoms?
For pain, are you experiencing pain?
I take morphine, narcotic for pain, daily, and then I have neuropathy, so I take gabapentin for that.
And how do you manage taking all those different medications, and how can you, is there any way that I can help you do that better?
Go ahead, give her something.
Okay.
You can make it up. It's simulation.
I manage them pretty well because I've been on them for a long time, so I just take them as prescribed and as my doctor tells me to. I don't really know how you could help me take them better unless you want to go to my house. No, I think I'm doing a pretty good job. I take them as directed, like my doctor prescribed. I don't overuse. Some of them that say to take with food, I do that. Is there anything you would say that I would need to do differently?
Sounds like you're doing pretty well.
Okay. Do you have any other questions?
No.
Okay, she wants a pause. Did you see the look? She was like, phone a friend. Nice job. So there are some basic questions that we have to ask in each of our interprofessional, in each of our healthcare specialties. So you asked those questions. I thought a couple of things you did really well is, what side effects are you having? It's not easy for people to bring up sexual difficulties, constipation, diarrhea, some of the stuff that goes along with this, and really allowing a safe space to do that and just asking an open-ended question can be really, really important to your patients. So don't shy away from that. And I thought you handled that really, really well. You did this great thing where you caught yourself. You said, how do you manage taking your meds? And then you went, how can I help you manage taking your meds? That's great, right? Don't be afraid. There's a couple of things in that. Number one, when you say, how can I help? People are more willing to tell you how you can help, how they can be helped. They're much more likely. It opens up that door. The other thing is, as you're out there, all of you young, wonderful health professionals, you are going to be in the room and you're going to say something someday and you're going to be like, oh my God, I can't believe I just said that. It's going to happen. You're going to misspeak. You're going to want to rephrase. Don't be afraid to do it. Just rephrase it if you feel like you haven't quite said it in the way that you want. Don't be shy about doing that. It's important that you do that and that you really say it to the best of your ability and in the most understandable way for your patient. This might be a patient who you might have expected has trouble maybe swallowing all of her medications. That might be a specific question you may ask. A newly diagnosed scleroderma patient may not realize that swallowing medications is actually an issue that goes along with their scleroderma. They may not know that yet. So you always want to think about, how can I ask these open-ended questions, but how can I ask some of the focused questions that these patients may not realize are actual symptoms that I may be able to help them with. So you don't want to be afraid of that. So that was good. It was interesting. Something you said, Amy, is you take morphine for pain, and you actually said, I don't overuse. And I think that's really telling. I'm glad you said that. I don't think that a lot of patients are able to say that, and I think it's a great way for you to advocate for yourself, but it is part of one of the questions that might be in your head, so she just put it right out there. But I think it's a good question to ask. You may have found out, how do you manage your medications? Your question to that could be, I run out of, my opioids at the end of every month. Well, that tells you something. Their pain is not being managed, and they need something, they need other help. That might lead you to send to a physical therapist. Yeah. Look at that, how we make those transitions. Isn't it amazing when you have a plan?
Hi, Amy. I'm Mike. I am a physical therapist, and I just wanted to let you know, have you ever seen a physical therapist before?
Yes.
Okay. Do you know about what we do?
Yes, but you can tell me again.
Okay. I'll let you know, just in case you don't know. All right. So I'm here to evaluate your movement system. Can everyone hear me okay?
Can you hear in the back? All right.
All right. I'm here to evaluate your movement system. So I heard your occupational therapist talk about you said to her some of the activities that you were having trouble with. Mm-hmm. Well, my job is to evaluate the way you're moving and to see what factors are limiting that movement. So it could be weakness, it could be stiffness, it could be pain, and see how those individual factors collectively are preventing you from doing what you want to do.
Okay.
So what do you feel like right now is your most pressing issue in regards to movement and doing your activities of daily living?
Stiffness.
Okay.
In the joints. If I sit too long, I'm stiff. If I stand too long, I'm stiff. Especially when I get up in the morning, I'm stiff all over.
So you're saying it's different at different times of the day. You're more stiff in the morning. Is this a systemic stiffness, or is this something that is your symptoms present in one area of the body more than others?
It's usually my neck, my lower back, and my knees.
Okay.
Yeah.
How would you say that's affecting your ability to do the things that you want to do?
I would say that it hinders me from having full motion to like bend down, pick up things. So I would say if a scale from 1 to 10, I would say it's probably hindering me would be like a 6.
Okay. Is there specific things at home that are pressing that are hard to do? Like you mentioned, getting up and down the stairs. Are you living alone? Are you driving? What are the tasks that you would have to perform on a daily basis?
That I have trouble with? Is that,
Yeah,
okay.
that would cause you trouble.
I live with my parents, so I don't live alone. I do drive. I think the trouble, my most troubling tasks as far as stiffness would be just like in the morning, I'm the most stiff, so getting dressed or like bending down to throw clothes in the hamper or maybe reaching up to get dishes off the top shelf, you feel pain and stiffness from that.
Okay, so there's certain movements that provoke pain, inhibit the things you want to do. Is there anything that make the symptoms better or strategies that you use that can make the
Not doing them.
Okay. Are you doing any activity during the day?
Well, I
are
do
you sedentary?
like stretches in the morning. I take hot showers in the morning. That helps to kind of relieve some of the stiffness. And that's pretty much what would kind of helps alleviate a little bit.
Okay, so you're doing some stretching daily, and hot showers seem to help.
Yeah.
You're not doing any strengthening or anything like that.
No, I have. Well, that's another. I have grip issues, so I can't really do weight lifting. And then I have pulmonary issues, so I can't do cardio. A lot of cardio, things like that.
Okay.
So.
Can you dive into that a little bit more? What specifically is preventing you from
I have
doing the cardio?
pulmonary fibrosis, and then I have hypertension, so I get short of breath. And I have feet issues from the Raynaud, so walking long distances makes me get short of breath, and then causes my pain in my feet.
Okay. Is there a certain amount of time of activity where the symptoms come on, or is it just walking in general, or walking for 10 minutes or 20 minutes or a certain distance?
Well, there's different variables. If it's cold out, if it's hot out, if I'm doing hills, if I'm doing stairs, if it's rocks, if it's sand, if it's a flat surface. So, there's all different kinds of variables. But I would say if it's, like, say I'm walking in the mall, I could probably do halfway around, maybe half a mile at my pace before being short of breath.
So I have to pause you even though I want to hear more. Scleroderma patients are complicated.
Sorry.
Really? This is the perfect IPE event. I liked your explanation of a PT as someone who evaluates movement. I think that's a really nice way to describe it. I thought that was great. And then you gave her some things. This could be weakness. This could be stiffness. This could be pain. So sometimes you have to tell them, hey, what do I want to talk about now? Especially a more complex patient. So that you may have to just choose. So this is what we're going to talk about, your stiffness, right? But I think giving them some ideas, what that does is it allows them to tell you what they're worried most about or what's hardest for them, which is exactly what she did. She went right to stiffness, right? And that's where she really wanted to concentrate. I liked the question, what is this preventing you from doing what you want to do? That's that impact on life. That's huge. And it can be different for everyone. When my son was young, I couldn't, going sledding with him was like pretty much impossible because my hands were white pretty much instantly. That was an impact on life for me that might not be for other people, but find out what specifically so that you can help them with that. You used the word systemic, which Amy knows, but other people may not. right? So you got to be careful of those words. And we all sitting here, we all know it, but patients don't often say like, I don't actually know what you're talking about. They just glaze over and nod. Systemic. So just be aware of that. But then you explained it differently. So that's the other thing. Jargon is going to come out of your mouth.
Did you notice that I did glaze over and nod?
I can't see you, but I'm really proud of your yes/no answers today. But they just glaze over. They don't tend to ask. So sometimes you're going to say a word and be aware of those nonverbals, right? And then you may need to explain it a little more fully. I loved that she gave a 1 to 10 scale without being asked. On a 1 to 10 scale of hindrance, which we didn't even know a 1 to 10 scale for hindrance existed, but we now know. So that's a savvy patient, but that can be important to know. And then you put in your chart, said hindrance 6. Next time, what if you found out hindrance is 4? You know, which is great. Another one, you clarified how much weight was lost instead of, earlier. So that was really important as well. Another one. Contextual features. Do you drive? Do you live alone? That's important, right? If she's really uncomfortable in the morning, getting the cereal bowl down could be more than she could handle, much less making herself a healthy meal. So I thought that was great. Don't forget those contextual features. That's what plays into people's lives, and that impacts their disease process. It impacts how the disease it affects them. Yeah, that was great. You guys are awesome. We have one more. I have no idea how much time I have. Am I doing okay? 5? All right, 5 minutes. Come on, one more. All right. So you're going to assume that she was referred because she's had a particularly rough few months and she's been a little bit down.
Makes sense.
Does that work for you guys?
Absolutely.
Cool.
Hi, Amy. I'm Megan. I'm a psychology clinical intern. So you've been referred to me because I hear you've been having some problems. Can you tell me what's going on with you?
I've just been having some depression. I was recently diagnosed with a chronic illness, and I'm trying to navigate through that.
Okay. Do you think the depression is brought on due to the diagnosis or because of your symptoms?
Both.
Oh, okay. Is there one that's more severe for you?
I think it would probably be more of the symptoms. It just seems like it's something new every day. And when you go to the doctor, a lot of times there's not, a perceivable answer that's going to make it go away. You just get told that, well, that's what happens when you
Absolutely.
Scleroderma,
That must
so.
be really frustrating. Do you
Yes.
have a good care team?
Yes, I do.
Good. Do you trust them?
Yes.
Perfect. And do they make you feel like you're listened to?
Absolutely.
Okay. And are there things that you're just feeling like you're missing in your care?
I don't know if it's missing in care, but sometimes I just feel like my symptoms maybe go unrecognized because they either are chalked up to my disease as a whole or they don't know what to do with me.
Okay. All right. What can I do to help you with the symptoms you are having?
I don't know.
Okay. Well, my goals would be to help you start to process the feelings that you're experiencing in relation to the symptoms and your diagnosis. I want to make sure you have a safe place where you can talk about all of the emotions, good, bad, indifferent.
Okay.
How's that sound to you?
Good.
Great. Do you have any questions for me?
How are you going to make it a safe environment for me to talk about my emotions?
So, as a therapist, the ideal goal is I'm going to give you a place that is judgment-free and a place where you can ask questions or have emotions that society or family or friends would tell you maybe aren't good. So, the days when you're having a bad day and you just want to yell and scream, this is a place where you can actually do that and process the negative things that are really hard, that might be hard for you to express to people because you're doing okay because, not having as symptomatic of a day, but you're still really frustrated. So this is a place where I can help you process without fear of repercussion or judgment.
Okay.
I'm only stopping there because I have to. That was a fabulous explanation. And I wrote, ooh, tough question, which was great. She started with very open, tell me what's going on with you. And you brought up the term depression, which patients may not use. They may not use that term. I'm just feeling really down. I'm feeling really anxious. But she used that word, which is great. So that's where you started. Do you think your depression is due to your diagnosis or your symptoms? That is a hugely different conversation. I thought that was a really great opening question, right? Really good early on question. I thought that was really wonderful. And you named the emotion, frustrating. Sometimes we name the emotion and people go, it's not frustrating. And that's okay. That's okay. Say, okay, tell me what it is. It's okay to try to name the emotion. And if you get it wrong, you just say, oh, okay, well, tell me what it really is. So don't be afraid to do that. How can I help? What's missing in your care? How can I help? That could be a great question for everybody on an interprofessional team. How is your healthcare team? What is missing? I think that was a really great question. Everyone's nodding. Yes, all of the health professionals out there. I love it. Do you have any questions for me? And she says, so how are you going to give me a safe place? Or what are you going to do to help me? Right? Is that what you said? Yeah, man, she's tough. She's getting tough as the years go on. That was a great question. It was great. It was great. You know what? Amy is upbeat. She uses humor. She has a lot of symptoms. She makes the best of everything. And those, sometimes physicians, pharmacists, nutritionists, OT, PT, they may overlook that, or they may make some empathic remarks, but they need that support of a therapist who has the time and can create that safe place. It doesn't mean you should ignore it. You never should as the other professionals, but you should realize that sometimes, you want to concentrate on making sure she's eating right, that she's taking her meds right, that she can eat her food well, and she can move. So remembering, I think you guys did a great job of working with one another as a team. Mm-hmm. Final thoughts? Amy?
I thought they all did great.
Me too.
Yeah.
This was an amazing interprofessional team. I don't know, am I the one that has to close it? Or is Barbara going to come and bail me out? Oh, she's right behind me. She's going to come and bail me out. Thank you, team. Thank you for being great.
Thank you, guys.
Excellent job.